Welcome to today's deep dive. If you're listening to this, chances are you've at some point found yourself staring at a medication bottle.
Oh, absolutely.
Right. Reading that tiny printed insert, or maybe just scrolling endlessly through medical forums, trying to translate incredibly dense pharmaceutical jargon into, well, something resembling plain English.
It's basically a foreign language for most people.
It really is. It's a universal experience and, frankly, an overwhelming one. So today, we're pulling our source material directly from a platform built specifically to solve that problem. We're looking at the iMedix medical content engine.
Right, and for those who might not be familiar with the landscape of digital health platforms, iMedix is an independent medical information database.
Yeah, their entire editorial focus is dedicated to helping people better understand their treatments, the actual mechanics of their medications, and above all, patient safety.
They aggregate clinical data, dosing guidelines, side effect profiles, and real patient reviews into these massive, comprehensive dossiers.
Exactly. So today, instead of just reading you a dry, bulleted drug label, which nobody wants, we are going to do a comprehensive deep dive into one of their specific medication profiles. We're looking at a drug called Tadalafil.
Setting the clinical stage here, Tadalafil is a generic formulation.
Right.
The active pharmaceutical ingredient inside it is a compound called Tadalafil. Now, anyone who has paid even a little attention to pharmaceutical advertising over the last, say, 2 decades.
It's just hard to avoid, honestly.
Very hard to avoid. You'll recognize Tadalafil as the exact same active ingredient found in the blockbuster brand name drug cialis.
Right. But the reason this dunk dive is so compelling to me is that we are not just going to deliver an anatomy lesson today.
No, not at all.
Or a rote chemistry lecture.
Right.
When you spend time analyzing the dossier we have in front of us, you quickly realize that discussing this medication forces a much broader conversation.
We are looking at the literal intersection of cardiovascular biology, the deep, often hidden psychology of romantic relationships, and the incredibly complex, sometimes dangerous, modern digital pharmacy landscape.
It's wild.
Yeah.
We are talking about a chemical compound that fundamentally alters human confidence.
And behavior.
Right, and behavior, simply by changing the physical diameter of blood vessels. It's amazing.
It truly is.
I want to lay out the exact mission for what we're covering today, because we're putting a lot on the table for you.
A whole lot.
We're going to start with the pharmacology, how this molecule actually operates inside the human body. Then we'll examine the unique dosing schedules, which really break the mold of traditional medications in this class.
And we're going to spend significant time on the severe safety warnings.
Yes, the danger zone. Those demand absolute respect from anyone taking this.
And perhaps most importantly, we are going to decode the real-world patient discourse. The data includes actual reviews and stories from users.
Which gives us this unfiltered window into what this medication actually means for real people navigating complex physical and emotional hurdles. So whether you're currently researching treatment options for yourself, or maybe you're trying to understand a medication a partner or loved one was just prescribed.
Or you're simply fascinated by how a tiny chemical compound can rewrite a person's daily reality.
Exactly. Our goal is to give you a complete 360-degree view of the topic.
To truly grasp the impact of this medication, though, we have to start at the absolute foundational level. We need to look at the biological blueprint of blood flow.
Okay, let's get into it.
As mentioned, Tadalafil belongs to a specific class of medications known in the medical community as phosphodiesterase type 5 inhibitors.
PDE5 inhibitor.
Right. You will almost always see this abbreviated in the literature as PDE5 inhibitors.
I see that term constantly in the reading. Yeah. And I have to say, phosphodiesterase type 5 inhibitor is precisely the kind of dense, multisyllabic jargon that makes a patient's eyes just glaze over.
It is a mouthful.
It really is. I want to make sure we actually understand the mechanism before we move forward. From what I gathered from the sources, a good way to visualize this is to look at the human body's vascular system. So the arteries and veins, like a massive, complex, interconnected highway system.
That's a great way to look at it.
And in certain areas of the body, particularly in the reproductive organs and the lower urinary tract, you have these biological traffic cops.
The PDE5 enzymes.
Exactly. The traffic cops are the PDE5 enzymes. And their natural job in the body is to restrict lanes, slow down the traffic, and keep the smooth muscle tissue relatively constricted, which keeps the blood vessels narrow.
Right.
So my understanding is that a drug like Tadalafil essentially comes in and temporarily relieves those traffic cops of their duty. By inhibiting that enzyme, it opens up all the lanes, relaxes the smooth muscle walls, and allows for maximum blood flow to just rush into those specific regional areas.
That analogy captures the mechanics quite well, actually, but we can take it a step further to understand the specific chemical cascade, because it is an incredibly elegant piece of biology.
Walk me through it.
When a person experiences sexual stimulation, the body releases nitric oxide into the erectile tissue. That nitric oxide activates an enzyme that produces a substance called cGMP.
Okay, cGMP.
Right. You can think of cGMP as the actual green light on your highway. It is the molecule that directly tells the smooth muscles in the blood vessels to relax and dilate, allowing blood to flow in and create an erection.
So the green light says go, the vessels open up.
Precisely. The problem is the PDE5 enzyme, your traffic cop, naturally exists to break down that cGMP.
Oh, I see.
It is the body's way of hitting the brakes. If someone has erectile dysfunction or ED, the balance is off. The PDE5 enzyme breaks down the cGMP way too quickly before an adequate erection can be achieved or maintained.
So the traffic cop is overactive. It's turning the light red too fast.
Exactly. By taking a PDE5 inhibitor like Tadalafil, you are blocking the enzyme that destroys the cGMP. You are protecting the green light, allowing the smooth muscles to stay relaxed and the blood vessels to stay fully dilated.
Okay, that makes perfect sense for ED.
Yeah.
But wait, I want to pause there because the sources also explicitly state that this exact same medication is used as a primary treatment for benign prostatic hyperplasia.
BPH.
Right,
Yeah.
BPH. This is where I struggle to connect the dots in the data. BPH is an enlarged prostate. One condition seems entirely about vascular blood flow and achieving an erection, while the other is about an organ physically growing and restricting urine flow.
It seems disconnected.
It does. What is the physiological bridge that allows one single pill to treat both?
It is a common point of confusion, but it actually makes perfect sense when you look at the anatomy of the male pelvis.
Okay.
BPH is a non-cancerous enlargement of the prostate gland, which is a condition that affects a massive percentage of men as they age.
Right, very common.
The prostate is a gland roughly the size of a walnut that sits directly below the bladder, and crucially, the urethra, the tube that carries urine out of the body, runs right through the center of it.
Like a tunnel.
Exactly like a tunnel. When that gland enlarges over the decades, it physically squeezes the urethra. This causes a cascade of highly bothersome urinary tract symptoms.
Like what, specifically?
We are talking about difficulty initiating urination, a weak or interrupted stream, a constant feeling like the bladder hasn't fully emptied, and nocturia.
Nocturia.
That's the medical term for waking up multiple times during the night to urinate.
Oh, got it. That sounds exhausting.
It drastically reduces quality of life. Now, here is the bridge to your question. The prostate gland and the bladder are densely packed with the exact same type of smooth muscle tissue that we find in the blood vessels we just talked about.
Ah, so the muscle relaxing effect isn't just limited to the vascular system.
Exactly. The prostate has what we call alpha-adrenergic tone. Essentially, the smooth muscles within the prostate and at the base of the bladder are gripping tight.
They're clenched?
Right. Tadalafil relies on its systemic muscle-relaxing properties to treat the BPH. It chemically signals the smooth muscle inside the prostate and the bladder neck to relax.
So it doesn't actually shrink the prostate itself?
No, it doesn't shrink the actual size of the enlarged prostate. That requires a different class of drugs entirely. But by relaxing the muscular grip the prostate has on the urethra, it significantly relieves the pressure.
Opening the tunnel back up.
Exactly. This allows urine to flow much more freely and drastically reduces those frustrating daily and nightly symptoms.
The implications of that are actually profound when you consider the typical patient demographic. The data points out that older men very frequently suffer from both erectile dysfunction and benign prostatic hyperplasia simultaneously.
Very frequently. They are common comorbidities.
Historically, you would be looking at a patient taking one pill for the vascular issue and a completely different pill, perhaps an alpha blocker, for the urinary issue.
Right.
What we are seeing here is a massive paradigm shift. It seems we're moving away from treating isolated, disconnected symptoms and moving toward treating the entire regional biological system with one single molecule.
It represents a highly elegant pharmacological solution. You are addressing localized vascular tension and localized muscular tension with just one compound.
That's incredible.
However, the biological mechanism of relaxing smooth muscles by inhibiting PDE5 is not unique to Tadalafil.
Right, there are other drugs.
Other drugs in this class, such as sildenafil or vardenafil, accomplish the exact same biological task.
So what makes this one so special?
What truly separates this specific medication from its competitors, and the primary reason it has completely altered the lifestyle and psychology of the patients who use it, lies almost entirely in its pharmacokinetics, specifically its timeline.
Okay, that brings us to what the clinical guidelines refer to as the 36-hour window.
Yes.
Reading through the comparisons in the dossier, this appears to be the core differentiator between having to micromanage your life around a medication versus actually getting to live it. Let's look at the famous alternative, sildenafil.
Universally known as Viagra.
Right. The profile notes that sildenafil is a shorter-acting medication. It typically remains active in the body for about 4 to 6 hours. Furthermore, and this seems like a massive practical hurdle to me, its absorption can be significantly delayed or blunted if the patient eats a heavy, high-fat meal beforehand.
The food interaction is a critical variable. If a patient takes sildenafil after a large, rich dinner, the gastric emptying is slowed down.
So it just sits in the stomach.
Essentially, yes.
Well,
The medication might not absorb into the bloodstream in time to be effective when it is actually needed, completely disrupting the intended therapeutic effect. Tadalafil, the active ingredient in Tadalafil, possesses a vastly different molecular structure that results in a much longer half-life in the body.
I want to make sure we define that term clearly for everyone listening. When you say half-life in a pharmacological context, what does that actually mean for the person swallowing the pill?
In pharmacology, a drug's half-life is the amount of time it takes for the concentration of that drug in your blood plasma to reduce by exactly half. It is a measure of how quickly your body's metabolism clears the substance. Sildenafil has a half-life of roughly 4 hours. Tadalafil has a remarkably long half-life of about 17.5 hours.
That is a massive difference.
Because it takes so long for the body to metabolize and clear it, a single dose remains clinically effective for up to 36 hours.
Wow.
Furthermore, the clinical data specifically highlights that its absorption into the bloodstream is not significantly affected by food. A patient can have a high-fat meal, and the efficacy of the drug remains stable.
That distinction changes everything about how the drug is integrated into a person's life. Think about the psychological burden of a 4-hour window coupled with food restrictions.
It's stressful.
You are essentially medicalizing intimacy. You have to calculate, all right, our dinner reservation is at 7 TMO. It's a steakhouse, so it's a heavy meal. I need to take this pill at exactly 8:30 p.m. for it to work by 9:30 p.m.
Right, but what if the evening goes differently?
Exactly. What if we stay out later? What if we go see a movie? It introduces a clinical, scheduled anxiety into an aspect of life that is supposed to be relaxed and spontaneous.
Completely.
The 36-hour window of Tadalafil effectively removes the clock from the equation entirely. And because of this extended duration, the guidelines outline 2 completely distinct medical regimens for taking it.
The source material details an as-needed approach versus a daily use approach. Understanding the difference is vital for patient safety and efficacy.
Walk us through the as-needed approach first.
The as-needed or on-demand regimen typically involves a higher dose, usually a 10 milligram or 20 milligram tablet, taken at least 30 minutes before anticipated sexual activity.
Okay.
This delivers a powerful temporary surge of the medication that provides that 36-hour window of readiness.
And the daily use regimen?
The daily use regimen is a fundamentally different approach to treating the condition. This involves a much lower dose, strictly 2.5 milligrams or 5 milligrams, taken every single day at the exact same time, regardless of anticipated activity.
I find the concept of the daily dose fascinating. The literature suggests this is highly suitable for men who anticipate intimacy more than twice a week. Why take a small amount every day instead of just taking the larger pill when you need it?
It comes down to achieving what we call a steady state concentration in the bloodstream.
Steady state. Yep.
When you take a low dose every day, the drug begins to accumulate slightly in your system because the 17.5-hour half-life means yesterday's dose hasn't fully cleared before you take today's dose.
Oh, that makes sense. They overlap.
Exactly. After about 4 to 5 days, the levels in the blood plateau and remain continuous. If we look at the lifestyle implications, the daily dose provides continuous 247 readiness.
Wow.
It entirely severs the psychological link between the act of swallowing a pill and the act of intimacy.
You just take it with your morning vitamins and forget about it.
Right. It is also important to note that for the treatment of benign prostatic hyperplasia, the strict standard is the 5 milligram daily dose. You take it consistently, and typically over a period of 4 to 8 weeks, the patient will see the maximal improvement in their urinary symptoms as that steady state of smooth muscle relaxation is maintained.
And you wouldn't use the higher dose for that.
You would never use the 20 milligram high dose on a daily basis. The risk of compounding side effects would be far too high.
We have established a really solid foundation here. We understand the biological highways, the role of the PDE5 traffic cops, the significance of a 17.5-hour half-life, and the clinical protocols for dosing.
Right.
But to fully grasp the weight of this medication, we have to step out of the textbook and look at the human element. The platform provides a curation of actual user reviews and patient discourse.
Which is invaluable.
It really is. Reading through these, you quickly realize you are not just reading about biology. You are reading about profound psychological relief.
Aggregating patient voices is one of the most valuable functions of a comprehensive health platform like iMedix. Clinical trial data tells us if a drug effectively dilates a blood vessel. It tells us the percentage of adverse reactions.
But it doesn't tell the whole story.
No, it does not capture the sociological and psychological subtext of the condition being treated. Erectile dysfunction in particular carries an immense, often entirely silent stigma in society.
Men rarely discuss it with their friends.
Rarely. And they often struggle to discuss it with their partners or even their doctors. These reviews provide a highly candid look at the emotional weight of that stigma, the isolation it causes, and the subsequent psychological shift when the biological function is restored.
Let's look at a few specific voices from the dossier. There's a review from a user named Bruce. He writes that his wife is 14 years younger than him.
Okay.
He states, "Imagine what I experienced when there were problems with erection. I was jealous of her, but then I bought Tadalafil. I was satisfied as well as my wife." That is an incredibly raw statement.
It is.
He doesn't just say he was frustrated. He says he was jealous. This highlights how the natural process of aging, combined with complex relationship dynamics like a significant age gap, creates immense psychological pressure.
The use of the word jealous is deeply revealing there. He wasn't simply experiencing a localized physical ailment. He was experiencing a profound threat to his masculine identity and his emotional security within his marriage.
Right.
In the context of evolutionary psychology and aging, a decline in physical vitality can trigger deep-seated anxieties about inadequacy and replacement. For Bruce, the restoration of physical function didn't just fix a biological plumbing issue. It stabilized his relationship architecture.
It rescued his confidence.
Yes, and removed the lens of jealousy through which he was viewing his younger partner.
It fundamentally altered his daily emotional state. We see a different angle in a review from a user named John. John describes himself as a gym instructor who constantly exercises. He notes that he found this drug incredibly helpful because it relaxes his muscles and gives him a strong erection. Including John's review in the dataset is crucial, because it shatters one of the most pervasive stereotypes surrounding ED.
There is a widespread, persistent myth that erectile dysfunction only affects the elderly, the severely overweight, or those with catastrophic cardiovascular disease.
And here we have a fitness professional.
Exactly. Someone whose entire life is dedicated to physical optimization, dealing with the exact same issue. The reality is that ED can be triggered by a vast multitude of factors.
Like what?
High levels of physical stress, overtraining, elevated cortisol from lifestyle stress, minor underlying vascular anomalies, or deeply ingrained psychological blocks can all manifest as ED.
So it really doesn't discriminate.
Not at all. John's presence in this discourse serves as a reminder that this medication is a tool utilized across the entire spectrum of age and fitness levels.
And then there's a perspective from the other side of the relationship. A user named Katara writes about her partner's experience with the medication.
Let's hear it.
She says, "This medicine saved me from being embarrassed in front of my partner. It relaxes the muscle in a tense situation and then provides complete erection." Now, acknowledging that her phrasing is a bit unusual since she seems to be speaking on behalf of her partner's embarrassment, the key phrase that really stands out to me is tense situation.
That phrase is a perfect distillation of the psychological feedback loop that defines performance anxiety.
How so?
From a physiological standpoint, an erection is governed largely by the parasympathetic nervous system.
Which is what?
That's the part of the nervous system responsible for the rest and digest or feed and breathe functions. It requires you to be relaxed. When a man experiences an issue achieving an erection even once, it often creates intense anxiety about the next encounter.
Right, they get in their own head.
Exactly. The next time he is in an intimate situation, that anxiety triggers the sympathetic nervous system, the fight or flight response. The body releases adrenaline and cortisol. Adrenaline is a powerful vasoconstrictor. It actively shrinks blood vessels, drawing blood away from the extremities and reproductive organs to prepare the body to physically fight or flee.
Which is the exact opposite of what needs to happen.
It is the exact opposite. The situation becomes literally biologically tense.
It's a self-fulfilling prophecy. The fear of not functioning causes the body to release the exact chemicals that prevent it from functioning.
Precisely. The medication acts as a pharmacological circuit breaker.
I love that term.
By chemically forcing the smooth muscles to relax and dilate, despite the presence of anxiety-induced adrenaline, it interrupts the cycle of panic. The patient sees that their body is responding correctly, the anxiety dissipates, the sympathetic nervous system ramps down, and normal function is restored.
It's essentially giving the brain permission to stop worrying because the body's handling the mechanics.
Yes.
But as we read further into these reviews, we see the reality of how patients navigate these powerful drugs entirely on their own, outside of a doctor's immediate supervision.
Which introduces significant risk.
Right. There is a review from a user named Ben. Ben writes, I have hypertension, and good sex for me is very important. I have read about side effects, and I was afraid to use the erection stimulants. So I took half a tablet of Tadalafil, and again, I felt as a male.
Ben's narrative is a textbook example of modern patient autonomy, but it also highlights a very significant danger.
Because he's modifying his own dose.
Yes. He is highly informed. He knows he has a comorbidity, hypertension, or high blood pressure. He has clearly been researching the warnings online and is experiencing a very valid, deep-seated fear of drug interactions and systemic side effects. So he engages in what we call self-titration.
Meaning he physically cuts the pill in half.
He physically cuts it in half to minimize his perceived risk, attempting to find the lowest effective dose.
We see the inverse of that behavior in another review from a user named Martin, who notes that he had to bump his dose up to a full 20 milligrams because the lower dose simply wasn't effective for him. It demonstrates that patients aren't just blindly following instructions. They are actively tweaking, experimenting, and modifying their dosages based on their individual physiological responses.
This kind of experimentation is incredibly common, which is exactly why comprehensive educational platforms like this are so strictly necessary.
To give them the guardrail.
Exactly. While taking half a pill might have been a safe and ultimately effective choice for Ben, his underlying fear regarding his hypertension was completely 100% justified. These are not benign recreational supplements.
They're serious medications.
They are powerful systemic vasodilators. When you take a medication that fundamentally alters the blood pressure of the entire human body, you are entering a space where the margin for error can be incredibly small.
And Ben's very valid fear provides the perfect pivot point for the next phase of our analysis. Because while the psychological relief we just discussed is profound, we really have to look closely at the danger zone.
We must.
We need to unpack the severe, non-negotiable medical warnings associated with Tadalafil. If you are forcibly widening the blood vessels across the entire body, there will inevitably be consequences.
Absolutely. The safety advice curated in the dossier breaks this down methodically, starting with the common, less severe side effects. Because Tadalafil works by relaxing smooth muscle and dilating blood vessels, it cannot isolate that effect purely to the reproductive organs or the prostate.
It acts systemically.
It acts systemically. Therefore, the most common side effects are direct results of vasodilation occurring in places you don't necessarily want it.
Like where?
Dilation of the blood vessels in the head causes headaches. Dilation of the vessels in the skin causes facial flushing. Dilation of the vessels in the nasal passages causes severe congestion.
That makes perfect mechanical sense. But the clinical data points out one specific side effect that is notably more common with Tadalafil than with shorter-acting drugs like Viagra. The guide specifically warns about back pain and muscle aches, medically referred to as myalgia. It notes that these aches typically hit 12 to 24 hours after taking the pill and can last up to 48 hours. Why does a blood flow medication cause a backache 2 days later?
The precise pathophysiology of this specific side effect is still a subject of ongoing study in the medical community, but the prevailing understanding links it to the fact that PDE enzymes are not monolithic.
There isn't just one type.
Right, there are many. While Tadalafil is highly selective for the PDE5 enzyme, it also has a slight cross-reactivity with another enzyme called PDE11.
PDE11, okay.
PDE11 is found in skeletal muscle tissues, particularly in the lower back and legs. So while the drug is effectively doing its job in the vascular system, its mild interaction with PDE11 in the skeletal muscles can cause localized inflammation or tension.
That is fascinating.
It serves as a potent systemic reminder that when you ingest a pharmaceutical compound, it distributes everywhere. It does not exist in a vacuum.
A headache or a sore back is an annoyance, certainly. But the safety data escalates quickly into what they term seek immediate medical help emergencies.
These are critical.
Let's discuss priapism. The definition provided is a painful erection lasting more than 4 hours. The literature classifies this not just as a side effect, but as a urological emergency.
It is a severe emergency. If an erection persists for more than 4 hours without subsiding, the blood becomes trapped within the cavernous tissue of the penis.
It can't drain out.
Right, because fresh, oxygenated blood cannot flow in, the trapped blood becomes completely depleted of oxygen. The tissue essentially begins to suffocate. This creates a compartment syndrome.
That sounds incredibly dangerous.
It is. If the blood is not drained medically in a hospital setting, the lack of oxygen will cause severe, irreversible necrosis.
Tissue death.
Tissue death. The ultimate irony and tragedy of priapism is that if left untreated, the resulting tissue damage will cause permanent, completely untreatable erectile dysfunction.
That is sobering.
It is a statistically rare event, but it is a catastrophic risk that requires immediate emergency room intervention.
The warnings also briefly mention sudden decrease or loss of vision, specifically a condition called NAION, which involves disrupted blood flow to the optic nerve.
Yes.
And sudden hearing loss. The directive is unequivocally clear. If you experience either, you stop taking the medication immediately and seek emergency care.
Immediately.
But among all the warnings in this dossier, there is one that really stands out. It is listed in bold as an absolute contraindication. It is the warning regarding the concurrent use of nitrates.
This is arguably the most critical safety information in our entire discussion today.
Let's emphasize this.
In medical terminology, a precaution means you should be careful. An absolute contraindication means there is zero gray area. You must never, under any circumstances, combine a PDE5 inhibitor like Tadalafil with any form of organic nitrate.
Let's clearly define what nitrates are so you, listening, understand exactly what to look out for. The guide lists prescription nitrates used for angina or chest pain.
Okay.
These include drugs like nitroglycerin, isosorbide dinitrate, or isosorbide mononitrate. But it also explicitly lists recreational drugs, specifically amyl nitrite or butyl nitrite, which are commonly sold on the street or in adult stores under the name poppers.
Yes.
What is the physiological mechanism that makes this combination so deadly?
If we revisit our earlier discussion on the biological mechanisms, we established that Tadalafil works by protecting cGMP, keeping the blood vessels wide open.
It stops the body from hitting the brakes.
Exactly. Nitrates, on the other hand, are heavy-duty nitric oxide donors. Their medical purpose is to forcefully and rapidly flood the system with nitric oxide to widen blood vessels around the heart to stop an angina attack.
So they are forcing the vessels open too.
Yes. If a patient combines a nitrate with a PDE5 inhibitor, the two drugs do not simply add to each other. They have a massive synergistic effect on the exact same chemical pathway.
They multiply each other's effects.
They cause a profound, unconstrained relaxation of the vascular walls system-wide. The result is a catastrophic plunge in blood pressure.
It just bottoms out.
The pressure drops so low and so fast that the heart cannot pump blood efficiently. The brain and the heart muscle itself are instantly deprived of oxygen. This leads to severe syncope or fainting, myocardial infarction, a heart attack, and potentially death.
A lethal biochemical collision.
It is exactly that, a lethal biochemical collision.
That is terrifying, and it perfectly illustrates why these medications require a doctor's prescription and intense oversight. The dossier also warns about interactions with alpha blockers.
Right, which we touched on earlier.
We discussed earlier that alpha blockers are often prescribed for BPH or high blood pressure, drugs like Flomax or doxazosin. Taking them concurrently with Tadalafil can lead to symptomatic hypotension, which essentially means the patient's blood pressure drops significantly when they stand up, causing severe dizziness or fainting.
It's a significant risk of falls, especially in older patients.
But there's one more interaction I want to dig into because it sounds almost like an urban legend until you read the science. The warning regarding CYP3A4 inhibitors.
Ah, yes, the grapefruit juice warning.
Exactly. You see, do not take with grapefruit juice printed on the warning stickers of dozens of different pill bottles. And frankly, most people have no idea why a breakfast beverage could be dangerous. The explanation provided in the data is fascinating.
It is one of the most interesting quirks of human metabolism. CYP3A4 is a highly specific enzyme located primarily in your liver and in the wall of your intestines.
Okay.
You can think of it as your body's primary waste management or detox enzyme. Its specific job is to identify foreign compounds, including dozens of different pharmaceutical medications like Tadalafil.
It identifies them, and then what?
It metabolizes them, breaks them down, and clears them out of your bloodstream. Grapefruit juice, and to a lesser extent some other citrus fruits like Seville oranges, contains naturally occurring chemical compounds called pharmacokinetics.
Pharmacokinetics.
Yes, these pharmacokinetics actively bind to and completely inhibit the CYP3A4 enzyme in your gut.
Let me try to build an analogy here for the listener. Imagine the CYP3A4 enzyme is a strict bouncer at the exit of a nightclub.
Okay, I like this.
And his job is to kick the tadalafil out of the club at a steady, predictable rate so the club doesn't get overcrowded. The pharmacokinetics in the grapefruit juice act like a group of incredibly rowdy, distracting guests that completely occupy the bouncer's attention.
That's very accurate.
Because the bouncer's entirely distracted, he stops kicking the tadalafil out. The tadalafil just stays in the club, and as the patient takes their next dose, the crowd inside the club builds up more and more.
That is precisely what happens on a pharmacokinetic level. Because the liver and intestines are temporarily unable to metabolize and clear the drug, the bioavailability of the tadalafil spikes.
It just accumulates.
The concentration of the medication in your blood builds up to levels far higher than the intended dose. A patient might have taken a safe 10-milligram pill, but because they drank a large glass of grapefruit juice, their bloodstream is experiencing the effects of a massive overdose. This significantly raises the risk and severity of every single side effect we just discussed. The systemic drops in blood pressure, the headaches, the risk of priapism. It is a very real, very dangerous biochemical interaction.
The warnings in the source material conclude by clearly delineating who should absolutely not be taking this. It is stated to be unsafe for women, contraindicated for pregnancy and breastfeeding, and unsafe for anyone under 18.
Standard but vital precautions.
But perhaps the most sobering warning in the entire document concerns cardiovascular clearance.
This is a point of paramount importance that often gets completely glossed over by patients eager for a prescription.
Why is it so crucial?
The physical act of sexual activity inherently increases cardiac output, heart rate, and blood pressure. It is essentially a cardiovascular stress test.
Right, it's a workout.
Exactly. The clinical guidelines explicitly state that tadalafil and all PDE5 inhibitors are contraindicated for men for whom sexual activity is clinically inadvisable due to an underlying unstable cardiovascular status.
Meaning their heart is already too weak.
Yes. If a patient has unstable angina, severe heart failure, uncontrolled arrhythmias, or a recent history of a stroke or myocardial infarction, their heart may simply not be able to handle the increased demand.
And then you add the pill.
When you combine the physical exertion of intimacy with a medication that systemically lowers blood pressure, the heart has to work exponentially harder to maintain perfusion. If the heart is already compromised, the risk of a fatal cardiac event is incredibly high.
That is terrifying.
A thorough, honest cardiovascular assessment by a physician is absolutely mandatory before this drug is prescribed.
And that concept of a mandatory doctor's visit is the perfect bridge to our final and perhaps most complex topic. We have established that profound risks exist. We know the nitrate interaction is fatal.
Yes.
We know cardiovascular clearance is required to ensure the patient's heart can handle the physical strain. But we also know that the cost of brand name medications in countries like the United States can be astronomically high.
Prohibitively high for many.
And the stigma of sitting in a doctor's office to discuss erectile dysfunction is heavy. What happens when a patient decides the cost or the embarrassment is too high and they attempt to bypass the medical system entirely?
This is where things get very complicated.
This brings us to the economics of access, the role of international generics, and what the dossier aptly refers to as the digital Wild West.
This is the space where advanced medical science collides with the harsh realities of the global pharmaceutical supply chain. As noted in the data, Tadalafil is not manufactured by Eli Lilly, the maker of Cialis.
Right.
It is manufactured by Cipla, Ltd. Cipla is a massive, highly reputable global pharmaceutical corporation based in India. Tadalafil serves as a much lower-cost generic alternative to the brand-name drug.
The term generic is incredibly loaded for a lot of patients. There is a persistent perception that generic means inferior or watered down. The iMedix guidelines emphasize the concept of bioequivalence. I want to understand what that actually means. If a patient buys a generic, are they getting a lesser version of the drug?
Not if it is a true, legally manufactured generic. Bioequivalence is a very strict, scientifically measurable pharmacological standard.
How strict?
Very strict. For a regulatory agency to approve a generic drug, the manufacturer must prove that their pill delivers the exact same amount of the active ingredient, in this case tadalafil, into the patient's bloodstream at the exact same rate of absorption as the original brand name drug.
So the active part is identical.
The pharmacokinetic profile, the curve of how the drug peaks and clears in the blood, must match within a very tight statistical margin, usually between 80 and 125%.
But the pill might look different.
Right. The inactive ingredients, the binders, the fillers, the dye used to color the pill, those can and do change, but the active therapeutic effect on the body must be chemically identical.
That's reassuring.
When manufactured correctly by a reputable company, generics are a triumph of public health. They offer massive, life-changing financial relief, making long-term essential medicines accessible to millions of people who otherwise could not afford them.
But when you actually look at how the iMedix database categorizes these medications, you see a very distinct separation. In their index, they have a list of FDA-approved drugs, marked with a clear green check mark.
Great.
These are drugs you find in any local pharmacy, things like Rybelsus, Diflucan, or Amoxil. But right below that, they have a completely separate category titled non-FDA-approved generics, for reference only.
Yes, that distinction is crucial.
And that list, marked with a red X, includes drugs like Comagra, Vitalista, and Tadalafil. If Cipla is a massive, reputable global pharmaceutical company, why is their drug sitting on the non-FDA-approved list? Is it unsafe?
This requires a clear understanding of international regulatory frameworks. Pharmaceutical approval is not a global monolith. It's conducted on a strictly country-by-country basis.
Okay, so every country has its own FDA.
Exactly. Cipla is indeed a major pharmaceutical giant, and Tadalafil is fully reviewed, legally approved, and regulated by the health ministries in many countries around the world.
But not the U.S.
However, while the active ingredient Tadalafil is FDA approved in the United States, this specific branded generic formulation, Tadalafil by Cipla, has not been submitted through the incredibly expensive, specific, and bureaucratic FDA approval process required to be legally sold domestically in U.S. pharmacies.
So platforms like iMedix are basically acting as impartial global encyclopedias. They recognize that these specific international drugs exist, that millions of people globally use them safely under their own local regulations, and the platform provides the necessary pharmacological safety data for them.
Yes.
But they are drawing a hard line in categorizing their specific regulatory and legal status for patients residing in the United States.
Exactly. It is entirely about transparency and protecting the patient. The platform provides the clinical truth of the molecule, but makes no attempt to endorse the procurement of unapproved versions.
Which makes sense.
And this global availability is exactly what fuels the dark side of online accessibility. Because, as we discussed, erectile dysfunction carries such a heavy sociological stigma, many men are deeply embarrassed.
They don't want to go to the doctor.
They do not want to endure the perceived humiliation of sitting in a doctor's waiting room or having that highly personal conversation. Combine that stigma with the high cost of domestic brand name pills, and you have millions of men turning to the internet searching for these lower-cost international generics.
And the source material issues a stark, flashing red light warning about this exact behavior. They explicitly and repeatedly warn patients against purchasing prescription-only drugs from unverified, rogue online pharmacies.
Because when a patient purchases a medication from an unverified, unregulated website, they have absolutely no verifiable idea what is actually arriving in the mail.
It could be anything.
Legitimate international pharmacies exist, of course, but the internet is flooded with sophisticated rogue operations. The warnings highlight that these unregulated sites are the primary source of counterfeit pharmaceuticals.
Fake pills.
Fake pills. A patient might purchase a blister pack labeled Tadalafil, but it could contain absolutely zero active ingredient, rendering it useless.
Which is a scam, but at least it's not toxic.
True, but worse, it could contain 3 or 4 times the safe dose of Tadalafil, practically guaranteeing a severe adverse reaction. Or, most dangerously, It could be cut with toxic industrial fillers, heavy metals, or completely different, undisclosed pharmaceutical agents.
The deception is the point. And even if we assume a hypothetical scenario where a patient miraculously navigates the digital Wild West and receives a perfectly authentic pill from an unregulated website, they are still falling into a massive, potentially fatal trap.
Because of what they bypass.
Exactly. If you recall the danger zone, we just spent so much time unpacking. The nitrates, the alpha blockers, the cardiovascular clearance. If a patient bypasses the doctor to buy pills online, they're completely bypassing the gatekeeper.
They're entirely on their own.
They are bypassing the mandatory cardiovascular assessment. They are bypassing the medication interaction review. No physician or pharmacist is there to check their medical history to see if they are taking a nitrate for angina or Flomax for an enlarged prostate.
It's incredibly reckless.
They are flying blind with an incredibly powerful systemic drug that alters their entire cardiovascular system.
Which is the ultimate overarching danger detailed in this entire deep dive. The unprecedented convenience of the modern digital pharmacy landscape is a double-edged sword.
It really is.
When that convenience is divorced from actual professional medical oversight, it transforms a generally safe, life-improving medication into a massive, uncontrolled liability.
I think we need to take a breath and zoom out here because we have covered an immense amount of complex territory today. Let's recap the journey we've taken through this data for everyone listening.
Let's do that.
We started the biological blueprint of blood flow. We unpacked exactly how a PDE5 inhibitor like Tadalafil operates, temporarily removing the body's traffic cops to protect cGMP, which relaxes smooth muscles and dilates blood vessels.
Right.
We saw how this elegant biological mechanism brilliantly treats both the localized vascular failure of ED and the frustrating muscular tension and urinary symptoms of an enlarged prostate.
From there, we explored the revolutionary pharmacokinetics of the drug. We broke down the 17.5-hour half-life that creates the famous 36-hour window of efficacy.
The steakhouse dinner freedom.
Exactly. We contrasted that with shorter-acting drugs delayed by food and detailed how the distinct daily versus as-needed dosing regimens offer profound lifestyle flexibility, effectively uncoupling the medication from the anxiety of the clock.
Then we spent time analyzing the real voices of patients navigating these conditions. We looked at Bruce, John, Katara, Ben, and Martin. We decoded the deep sociological and psychological relief that comes from restoring physical function.
How it breaks the tense, self-fulfilling cycle of performance anxiety.
Right, and rescues self-esteem and stabilizes intimate relationships. But we also navigated the absolute necessity of respecting the danger zone. We explored the physiological reasons behind systemic side effects like muscle aches, the urological emergency of priapism, and the fatal non-negotiable contraindication of combining these drugs with organic nitrates.
And we even unpacked the bizarre but critical interaction with the CYP3A4 enzymes and grapefruit juice.
And finally, we navigated the incredibly complex economics of access. We clarified the strict scientific standard of bioequivalence that defines high-quality generics, while simultaneously confronting the severe, life-threatening dangers of utilizing unverified, unregulated rogue online pharmacies.
Pharmacies that allow patients to bypass vital medical oversight and cardiovascular clearance.
Which brings us back to the core reason platforms like this exist. Navigating your healthcare, understanding the dense chemistry of your prescriptions, and deciphering your risks, it does not have to be done in the dark.
No, it doesn't.
This deep dive is a reflection of the ongoing mission of the iMedix platform. They are doing the hard, exhaustive work of compiling this clinical data, translating the pharmacokinetics, parsing the severe warnings, and elevating real patient discourse to empower readers. It is about fostering clear educational conversations regarding patient safety.
Because at the end of the day, clinical data and pharmaceutical knowledge are only truly powerful when they are clearly understood and safely applied by the patient.
Absolutely.
The depth of the information we have discussed today underscores exactly why every patient must proactively advocate for their own health, but it also unequivocally highlights why that advocacy absolutely requires full, unvarnished honesty and transparency with your medical providers.
I couldn't agree more. Now, before we conclude, I want to leave you, the listener, with one final thought. Something to ponder long after this audio stops playing.
I'm intrigued.
We spend so much of our conscious lives rigidly separating the mind and the body. We tend to believe that our confidence, our jealousy, our profound sense of self-esteem, our social anxiety, that all of those complex emotions live strictly in our brains and our thoughts.
Right, our internal monologue.
And we believe our physical ailments, our blood pressure, our muscle tension live strictly in our bodies. But when you spend an hour looking closely at a drug like Tadalafil, a single, tiny, microscopic chemical compound that does absolutely nothing more than temporarily change the physical diameter of a blood vessel.
Just opening a pathway.
And you see how that simple plumbing-level biological shift can completely restore a person's self-worth, rescue a fracturing marriage, and entirely rewrite their daily emotional reality. You have to ask yourself a somewhat unsettling question.
Which is?
To what extent is our very sense of identity, the core of who we think we are, just a delicate, easily altered byproduct of our biology?
It is a truly fascinating philosophical question to end on.
It really is. Thank you for joining us on this deep dive. Keep asking hard questions, keep researching your health, and above all, stay safe out there.